Dr. Kalsi joins me now from Naperville, Illinois, just outside of Chicago. Thank you, Doctor, for being with us and for all that you do.
Thank you, Rosemary. Thanks for having me back on.
So, unfortunately, more than 250,000 Americans have now died from COVID-19. Cases and hospitalizations are surging. New York schools are closing indefinitely. New restrictions are being applied. And while President-elect Joe Biden met with healthcare workers Wednesday, the current president is absent but blocking Biden's transition. As a doctor, what is your reaction to where things stand right now in this country?
So, Rosemary, I can only speak to what I'm dealing with, boots on the ground, and our hospitals are full. And as you know, I'm at mid-tier and high-tier institutions and also rural hospitals. We are full with COVID, in addition to all the other emergencies that people come into the hospital with and elective surgeries that people have, and then they get admitted to the hospital. We are full to the brim and now seeking strategies to try to increase our ability to house these patients, decrease elective surgeries, which decreases funding to nurses and doctors and staff, which is critical. And we're at a tipping point in Illinois, in particular in the suburbs of Chicago.
So when the governors of Minnesota, Michigan, Illinois, Kentucky, and Wisconsin had a virtual meeting, they revealed the Midwest is the epicenter of the biggest COVID-19 surge to date, with long lines of people getting tested, new restrictions put in place. You're a doctor in the Midwest. What are you seeing at your hospital just outside of Chicago? You mentioned the fact that you've got people coming in. It's all full up. But what are you doing in terms of different treatments, different approaches to the people coming in?
It's a great question, Rosemary. The last time you and I met, we were just at the beginning of this illness. We had no idea how to really treat it. We thought we were going to do traditional clinical measures, traditional critical care measures to treat these patients when they came in with low oxygen levels and they were coming in with low blood pressures. Now we know better. We're not intubating or ventilating people right away. We're putting them on high flow oxygen, humidified oxygen. We are giving them steroids when their oxygen levels are low. We have adequate access to remdesivir, tocilizumab, and plasma, and in some cases, antibodies. And big institutions have that, and small institutions, we are able to transfer them to other big institutions to get those patients those measures. So we are much better at keeping these people alive, and less people, Rosemary, are dying from this. That being said, we're still getting inundated with patients in the ER. We are at an all-time high in terms of volumes, and we have 10 to 25% of staff out with COVID. And they're suffering without pay at some point. And they can't support their families because they have COVID. So this is a big problem, and we need them back because we need the help.
What are you experimenting with that might help people fight this virus?
So, and I don't mean to speak to patients as their doctor. As you know, Rosemary, I come on here as just to give you a boots on the ground experience of what's going on. But for my patients, in a discussion with them and their doctors, vitamin D is a huge supplement to prophylax and to treat COVID-19. Zinc supplements in certain doses is also a big thing, and also melatonin sometimes. And there's adequate data out there right now that suggests that there is some antiviral components to all three of these. Now, again, anything I recommend has to be discussed with your personal doctor or your emergency doctor. But these are things that are safe and low risk that are helping my patients, and also steroids.
So you are also seeing COVID fatigue. I mean, it's right across the United States and across Europe. We're seeing it right across the world, in fact. How frustrating is that as a doctor? And why do you think some Americans can't seem to comprehend the dangers posed by this virus, refusing to wear masks and follow other health guidelines in the middle of a pandemic?
Because this is new and novel, and we're Americans, and this is a country where we propagate free speech and freedom to opine about anything that you want, and that is the luxury of America. Part of the curse of America is that in times like this, Rosemary, I'm finding that it's challenging to convince people that we need to come together as a community to do the right thing. That being said, I have to respect Americans for doing what they think is right, and everybody has to take on that risk and take on that that burden when they are part of the problem.
That is a great answer. Dr. Raj Kalsi, you and all the other doctors and nurses are our frontline heroes. Thank you so much for your service.
Thank you so much, Rosemary. Thanks for having me on.